Good morning once again, and welcome to the Haven Financial Group radio show. We appreciate you listening this morning. If anything resonates with you, please give us a call at 612-504-8400. Visit us online, havenfinancialgroup.com. All kinds of retirement tools, calendar of events, and we have lots of classes in our education center and in community education throughout the Twin Cities as well. So we encourage folks, come on out to those events, learn something, and certainly if we can help you in any area of retirement, that's why we're here. On this part of the show, we got Glenn Ramey, our insurance specialist at Haven Financial Group. And when I say insurance specialist, Glenn knows his stuff from the long-term care, life insurance, Medicare, healthcare, all of those wonderful topics I'm sure the listeners just love to talk about.
Well, listen, I love to talk about it, and I always love to speak with Glenn. So it's great to have you with us, Glenn. And we're talking about the pillars of retirement planning in 2026. And Glenn, we've already been talking about the fact that here we are, mid-January. And while we feel like we're chugging already here in 2026, there's a lot of things that people still need to consider for this year. And one of those is certainly some of their insurance issues. I thought we would start by talking with you a little bit about FSAs and some of the deadlines associated with them, and some of the things people need to know here in January.
Yeah. So for those that might not know the acronym, right? Mm-hmm. FSA, flexible spending accounts, right? These are those things that the employers offer that aren't tied to any specific type of health insurance plan you have at your job. They're accounts that you get to set aside some of your paycheck pre-tax to be used for healthcare expenses during the year, right? And these are those ones that are use it or lose it accounts typically, meaning that if I don't spend that money by the end of the year, that employer gets to keep what's left in that account, right? Now, deadlines for spending the money is usually December 31st, right? That calendar year it was contributed in. But do check with your employer to make sure whether or not there's any grace periods that might allow you to use those funds all the way to March 15th, or might allow a limited rollover of those dollars that are still left in that account up to $660 in 2025 before forfeiting those dollars in that precious account that you have.
Absolutely. Now, those dollars can be used in a variety of ways, correct?
Absolutely. It's not just for medical bills, right? Dental bills, eyeglass bills. Mm-hmm. It's a vast variety of costs that you could use your flexible spending account for. Absolutely.
Absolutely. My daughter had one and she had money left in it, and she was allowed to use it at the pharmacy.
Yeah, even over-the-counter items, certain ones can definitely be used with those dollars as well.
Yeah, it's
and
important.
Tax-free at that.
You bet. So it's really important that people check that out. Don't let that money just go to your employer. That's certainly not an option that you want to exercise. Let's talk a little bit about HSAs.
Yeah. Wonderful health savings accounts. Yeah. Yeah. So again, the triple benefit to the HSA, right? The money goes in tax-free, the money grows tax-free, and the money is spent tax-free. We're huge fans of the HSAs and how they can benefit not just your immediate medical expenses, not just your immediate tax liabilities, but future liabilities as well, as those funds become expanded on what you can use them for once you transition into Medicare, as an example.
Okay. So now, how do people learn more about that, and how do they get involved?
So first off, you have to have a qualified health insurance policy at that employer, right? A high deductible plan, typically with no first dollar style benefit. So it can't have co-pays for your doctor appointments and medications. It's a strict kind of deductible health insurance policy at that. And then you're allowed to contribute, if you choose, up to $4,300 as a single individual or $8,550 as a family. And then there's an extra $1,000 makeup contribution per individual that's 55 years or older, which could bump that into a little over $10,000 that could be put into an HSA for a husband and wife in one calendar year.
Okay. Talk to us about the tax ramifications.
Yeah. So again, you're going to write that off your tax return at the end of the year.
Okay.
And you have the ability to make that contribution all the way up to the tax filing deadline. So don't be afraid that if you didn't put as much as you wanted to into the HSA in 2025 and have extra money you'd like to go into that health savings account, you have the ability to fund the previous year's HSA all the way up to the April 15th tax deadline.
What would be the downfall or the negative part of this, of an HSA, or is there at all?
There's very little negative. The negative I would say is that if you try to access those funds for anything other than a qualified medical expense, as defined by the IRS, you are going to not just pay income tax on the money you've taken out, you're going to pay a penalty for having taken it out prematurely. Now, that penalty is going to go away once you turn 65 and transition into Medicare eligibility. But prior to age 65, I would not be using your HSA to buy a TV, right, or anything like that, because you're going to lose that tax savings you put in there in the first place for, and on top of that, pay a financial penalty for doing so.
Absolutely. Glenn Ramey is our guest today. He is an insurance expert at Haven Financial Group. Okay, Glenn, I'm going to allow you to talk about this because this is a tough one, but it's an important one to talk about as the year gets started, and that's long-term care. This is something that nobody wants to talk about because we want to assume that if I would ever need long-term care, my kids would take care of me, so I don't need to worry about that. And when we think about it, we think about really high dollar amounts. So it's January 2026, and there's some folks out there who maybe have been thinking about this. Where do you start? What do you do?
Well, you start with a conversation, right? This is about planning. It's just part of that whole comprehensive, full approach of planning for your needs in retirement. And although none of us want to think that we'll be ending our lives in a nursing home, right, that we'll spend any time there at all, the sad statistics are 50% of us will. And not by choice, but by necessity. Right. And I think if you're not having this as part of a comprehensive plan for retirement, you're missing a big opportunity to take advantage of an ability to leverage your dollar today to be more for you later when those healthcare needs arise. And your health insurance isn't the thing that's helping you pay those medical bills at that time. It doesn't necessarily have to be insurance, although I think there's some great options in insurance planning now related to long-term care. It's not the only way we can plan for long-term care today. There are insurance options. There's asset-based long-term care options out there for people that might be better savers and don't want the desire to plan for something and lose if they don't get sick, right? Sure. Don't think that those are the only options anymore that are out there. There are a lot of ways you can be planning for long-term care today.
So, Larry, what I hear him saying is you got to sit down, you got to talk about this with a partner, and then you've got to come up with a plan.
You are 100% accurate. You talked about long-term care. We don't like to talk about it. It's a major focus at Haven Financial Group for 2026 to have these conversations. If you're listening and maybe you were scared off by a Cadillac plan 10 years ago, there's much better viable options that are out there. It starts with a conversation. And I'll piggyback that off that and say, Glenn, could you just comment with long-term care, our focus at Haven this year in 2026 is also life insurance reviews. Can you tell the listeners why?
Yeah, of course. So the importance of a life insurance review is to make sure something you're putting your hard-earned dollars towards that's actually going to be a benefit to your family upon passing. And the sad truth is that older policies, 5, 10, 15, even 20 or more year older policies in life insurance aren't always doing what you think they are. And if they're not paid attention to, if they're not monitored, you're going to find yourself with a very sad notice later in life that says that protection you thought you had, it's gone. And those dollars that you put towards it are gone. And we're trying to make sure that the people we help aren't left in that circumstance, that we're monitoring and checking these things now to make sure we're set up for success later.
Yeah, Larry, I've heard you say this many, many times. I mean, life insurance policies will eat themselves eventually in many cases. And the only way you really find out if you haven't gone back and looked at it, which this is not something people are doing on a regular basis, you find out when you need it and it's too late.
Yeah, you probably got it 5, 10, 20 years ago. Somebody sold it to you. You haven't even talked to them since. Haven't reviewed it. You assume that everything's going the way that they sold it to you was supposed to go. Doesn't always work that way. Life insurance contracts are certainly not all made equal. We're not saying you need a whole bunch more life insurance. If you do need life insurance, we have access to all the companies, and Glenn can help you find the most competitive, the right type life insurance. So if you're listening, go, well, I don't know which one I have. Do I have variable, adjusted life? Do I have permanent insurance? Do I have whole life insurance? Do I just have term insurance? Why not have a conversation? Just this past week, I had a couple in, and they had life insurance and long-term care. They're both retired from Lakeville. They've done a great job of saving. They said now they need a more of a retirement plan, that their guy has got them to where they need to go, but they're not confident he can get get them through retirement the way they would like. It's not what he specializes in. And their number one thing is, I'm not going to say the name of the company. It's a big box name.
Mm-hmm.
It's on TV. Typically, they're much more expensive. And they like, yes, we want this life insurance long-term care review. I can already tell, and Glenn and I can already tell you what we're going to find.
Sure.
It's a common denominator. They don't know the ins and outs of it.
Mm-hmm.
They have no idea they're paying way too much. And at the end of the day, ultimately, decision-making is based upon the facts. And I'm quite certain we're going to be able to help them.
Yeah. Well, and you gave a great example because there's someone who came forward and said, we'd like to review this. We might need some help. It's that time. And that's something that I think a lot of people are either afraid to do or don't realize they need to do. So they're at Haven Financial Group. You just heard it. They're going to have a real focus this year on long-term care, something that is hard to talk about, but the folks at Haven are prepared to sit down with you and talk about it and give you different options. And then also your insurance reviews. That time has come, folks, and you need to sit down with someone who can look it through and tell you if you're on the right track or maybe you need to deviate. That and so many other topics they can discuss with you. If you're looking for a partner in 2026, now is the time to give them a call at Haven Financial Group. The number is 612-504-8400. You tell them you heard us here and you'd like to set up a free consultation and talk a little bit about long-term care, or maybe you'd like to talk about your life insurance or putting together a retirement plan. Again, it's 612-504-8400. When we come back, we're going to continue our conversation about the pillars of retirement in 2026, including preparing for the 2026 with intention. This is the Haven Financial Group Radio Show.